Artifact is a very interesting phenomena. This is considered to be a distortion in ECG tracing or EKG tracing by electrical activity that is non-cardiac in origin. It's basically some kind of interference of some sort. So if the problem, we want to know, is it with the patient or is it with the equipment? Always check your patient first, always assess your patient. So how do we manage these artifacts? Well, we need to have the ability to recognize it. We need to definitely be able to differentiate it from the patient's rhythm, and then we need to take steps to minimize it or eliminate it. There are certain ways that you can avoid having artifact. A couple of things is making sure that you apply your equipment properly, having fresh electrodes, good placement, good skin contact. In other words, if you have a hairy patient, you may need to use some clippers so that you can get good contact on the chest. These electrodes do dry out, so when you're in the hospital setting, if you have a patient on continuous cardiac monitoring, you may need to change those every day to be sure that you keep good contact so you have a good tracing. So why are these considered problems? Well, it could mimic a dysrhythmia. It could look like a lethal rhythm. Maybe we're going to go in and we're going to unnecessarily provide treatment to patients or cause a big commotion if we think somebody's in VFib, ventricular fibrillation. It could mask an underlying problem, and possibly a lethal dysrhythmia may go unrecognized. That could result in necessary treatment being delayed. It's definitely time consuming. We have to check the patient, we have to check the equipment, and it can just, be something that's burdensome to staff and clinicians. So patient evaluation is always essential before initiating any medical intervention. There are some types and causes and cures of different artifacts. So one is called 60 cycle interference. So this would be some outside electrical signal producing some fuzzy baseline. A lot of times this could be cords or metal parts that are leaning on the patient or coming into contact with your wires that creates this sort of vibratory mechanism that's picked up by the electrodes passing the signal onto the machine. So sometimes this could be even your IV pump is against your bed and it's creating that vibratory mechanism. Somebody who is having maybe an ultrasound or an echocardiogram, those kind of waveforms could cause some interference. So you want to keep your monitor cables separate from each other and separate from other cords. This would be one where you would check electrodes and leads. There's something called motion artifact. So motion artifact can be from a muscle tremor, shivering, toothbrushing, loose electrodes, respirations, etc. Again, checking the electrodes and checking placement of the leads would be your cure for correcting these problems. Let's take a look at what you might see. This is very classic 60 cycle interference. If you notice your baseline between your R's, between your QRS's, or between your heart rate tracings, it's very in a set pattern. It's very vibratory in nature, looking very much like thickened and distorted. So that is 60 cycle interference. This one is motion artifact, so you can see, you really can't see a clear matchup of what's going on, and there's sort of a lot of variation, but it's not looking the same as the 60 cycle, right, which is pretty set pattern. Motion artifact looks a little bit different. Here's a couple of others. There could be a wandering baseline. So this is somewhere where the baseline is moving all around. Oftentimes this is a loose cable or a bad connection. It could be respiratory in nature, but it can be quite difficult then to decipher your regular rhythm. And then you could see the patient drop off the monitor, which could then appear like a systole or a flat line, and that would be something that you definitely want to verify that your patient is indeed asystole without a pulse before you do some actions. So let's take a look at these. So artifact or a wandering baseline, loose electrodes, you can see how there's no clear isoelectric line. It's sort of moving all around. It would be very difficult to decipher what rhythm this is. So you definitely would want to check your connections. If we're looking here, the top one would definitely be a 60 cycle interference. The bottom strip is definitely looking like some wandering baseline. So perhaps this patient is brushing their teeth. Again, the top strip is just very confusing. Absolutely looking like some kind of interference with brushing teeth. Probably that patient is brushing their teeth. This, let me go back here, I'm sorry. So the bottom strip here is just probably a respiratory variation with some interference. Perhaps this patient is shivering or having a seizure. And then off the monitor, as you can see, we have beautiful sinus rhythm, and then all of a sudden, whoop, we fell off the planet here. So this is something where you might see a lead broke or it just came off. So obviously you're going to want to check your patients, but then cleanse the area, cleanse the skin, and absolutely reapply your electrodes. So it is important that you can identify artifact, try to determine what kind of artifact it is, which would help you then to troubleshoot and eliminate that artifact. Again, if you have questions on content, please post your questions to the Raise Your Hand discussion forum on our Blackboard site. Thank you.